So we'll have to keep one more window open where we are sharing screen on YouTube. Currently, this is what we are sharing on YouTube also. But this we don't want to show.
No,
PPT, okay. Okay. Dr. I'm already given it.
But it is not showing.
I agree.
And doctors also. No doctors.
We'll have to tell the name.
After Sunita. Dr. Sunita. Sir. Yeah, admitting, sir. The actually changing the settings, that's why. These three people actually they are presenters, but they are not. Email ID required.
The name we need to know to add that.
नहीं कोई जरूरत नहीं वो रहेगी ना और ये तो है ही है ना। अच्छा निशुल्क कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम नहीं। कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम नहीं। कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम नहीं। कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। हाँ अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम कल किसका अलग टाइम पे रखो पर वो तो मुझे सके नहीं कोई जरूरत नहीं वो रहेगी और ये तो है ही है। अच्छा निशुल्क जैसे आएंगे तब लाएंगे। हाँ ठीक है उसका बाद में कर लो मैं तो ना इसलिए कोई प्रॉब्लम
British Biological as today is one of the leading and #1 prescribed nutraceutical company of India, and that is possible only because of your contribution to our products like B protein, D protein and Propial. We are proud to be an Indian company made in India by the Indians. With over 3 decades of presence since its inception in 1988, we have earned the trust and expertise in the field of nutritional supplements. We are proud to share that today British Biological has the largest manufacturing plant in not only India but also in entire South Asia as well as Southeast Asia. This state-of-the-art manufacturing facility is equipped with ultra-modern robotic technology and artificial intelligence, ensuring the highest quality standards for our products, and thereby, whenever you prescribe any of our British Biologicals product, your patients will get best of the quality at the same time, best of the taste. Some of our key products, as you are aware, are bee protein, a daily nutritional supplement for a healthy routine. We also have D protein, a nutritional supplement specially designed for diabetes and pre-diabetes patients. And we have Propiel, a nutritional supplement for pregnancy and lactation. Once again, I welcome all of you and look forward for an engaging session. Thank you. And now I would like to hand over the session to Dr. Kiran Bijur, who is our Head of Medical Affairs at British Biologicals. Over to you, Dr. Kiran.
Now, can you hear me?
Yes, Dr. Kiran.
Yeah. Dear delegates, a very warm welcome to all of you. I'm Dr. Kiran Bijur, Head of Medical Affairs of British Biologicals, and it is my distinct honor to introduce this special webinar series hosted on the Gynecology Tutor platform. GynTutor, conceptualized and developed by British Biologicals, serves as a dedicated platform for sharing clinical expertise, practical insights, and evidence-based solutions from a panel of esteemed experts. This initiative reflects our unwavering commitment to addressing critical issues in women's health and fostering collaboration among medical professionals to improve care outcomes. Today's session marks the beginning of a journey where we aim to exchange knowledge, discuss pressing concerns, and collectively explore effective solutions for advancing women's health care. I am confident that this webinar series will provide you with valuable takeaways and enrich your clinical practice through mutual learning and shared experience. It is my privilege to introduce our chairperson, Dr. Ritu Saxena, a distinguished senior consultant with over 2 decades of clinical excellence based in Lucknow. And also I am honored to have with us 2 renowned experts, Dr. Sunita Chandra and Dr. Sarika Agarwal, both senior consultants with extensive experience and unparalleled expertise in gynecology, also from Lucknow. With that, I have the pleasure of handing over the session to our chairperson, Dr. Ritu Saxena, to guide us through this insightful discussion. Thank you, and I wish you all an engaging and fruitful session. Thank you.
No, sir. No, I don't know.
हाँ रितु
No, sir. I stopped.
हाँ मैं बोलती हूँ उनको अनम्यूट करिए उसको, डॉक्टर रितु को प्लीज, जो भी देख रहे हैं इसको उसको अनम्यूट करिए, डॉक्टर रितु सक्सेना को अनम्यूट करिए और कैमरे को लॉगिन करने की परमिशन दीजिए। जॉइन स्लाइड पे दबाएं क्या? नहीं रितु ज्वाइन कर पाई?
Dr. Ritu, you can on your camera and you can come on. You have access.
अरे तू अभी भी नहीं हुआ? अनम्यूट करिए उसको रितु को, हु इज द कंट्रोलर ओवर देयर, उसको अनम्यूट करिए। वो अनम्यूट नहीं हो पा रही है। नहीं वो जो भी कंट्रोल जिसने लिया हुआ है ना वो अनम्यूट करेगा। हाँ तुम्हारा दिख रहा है नॉन म्यूटेड ही दिख रहा है अभी। हाँ हाँ बिल्कुल दिख रहा है। कैमरा भी तुम्हारा नहीं ऑन है लेकिन। अच्छा नहीं मुझे लग रहा है वो शायद ये लोग ऑन करेंगे तभी होगा, क्योंकि सारिका का ऑन है, मेरा ऑन है।
जी मैम।
हाँ
मेरा अपने आप ही ऑन हुआ है मैम।
उसका रितु का नहीं हो रहा है ना। हेलो somebody there from British Biological?
1 minute, madam. 1 minute. 1 second. We are doing it.
She has to read and there is no problem actually. Here also you can mute it.
Yes, Vishnu, what is the issue?
नहीं रितु को अनम्यूट नहीं किया है आपने, उसको अनवेरिफाइड डाला हुआ है ना अभी। ये नाम के आगे अनवेरिफाइड लिखा हुआ आ रहा है।
Just check it out, Mr. Vishnu.
Yeah, yes.
From our end, we have unmuted.
Our end we unmuted, sir. I think some technical.
She is unmuted, madam. She needs to rejoin again.
Yeah.
मैं बोलती हूँ उसको।
फिर उसको कट करके rejoin.
फिर से रिजॉइन करो उसको, वो कर दो और दोबारा से ज्वाइन करो, बस आ जाएगा। अरे मेरा ठीक है।
आपका ठीक आ रहा है, सारिका मैडम का भी ठीक आ रहा है, वीडियो एंड ऑल।
Patient Miss A, she is 16 years old and she was experiencing symptoms like today only have got one patient 19 years old and Saloni abhi दिखा के गई है बिल्कुल। तो she was like irregular periods, weight gain and acne and hair growth on face, on legs, ends, around breast, abdomen and some mood swings, hair loss on the scalp। तो कहा जाता है ना कि जहां बाल चाहिए वहां पर तो कम हो जाते हैं और जहां नहीं चाहिए वहां एक्स्ट्रा हेयर आ जाते हैं। This is about PCOS. And when they get either the periods are very irregular or they just don't come without medicine, and when they get periods it is very heavy bleeding and they sometimes they experience pelvic pain, sometimes not. Hair loss or thinning of hair is very common. Excess hair growth, yes, and mood swings because of all this, because hair growth is there either on the face or on the body, they're not comfortable. And I think everybody here understands that a young girl, I mean, it's her right to look beautiful. And hair on the face, they feel it is it's very frustrating. They feel we are not looking good. And especially in school and colleges, I mean, it all matters. So this girl, when she comes clinically, the diagnosis is made of polycystic ovarian syndrome or polycystic ovarian disease. And the incidence of this condition is elevated, possibly due to several factors, including but not limited to vitamin D deficiency, insulin resistance, hormonal imbalance, inflammation, lack of exercise, poor nutrition, and or genetic factors. So genetic factors definitely play a very, very important role. I have seen in my practice only both the sisters suffering from PCOS, mother. I have a family where mother had PCOS. I treated her. Then she had two daughters, and now the elder daughter is around 28 and the other daughter is around 25, and both of them had PCOS, and I've treated them, and one is already having 2 babies and the second is planning for it. So I mean, many of us will actually are seeing such kind of patients, and we witness that in our day-to-day practice. If mother is suffering from PCOS or the sister is suffering from PCOS, it's common to have in other sister. And nutrition, I'll talk about it a little later. Lack of exercise, yes, it is very, very important, because today's generation, they just don't want to get out of the bed. Everything is on bed. खाना है, पीना है, सोना है. इवन शॉपिंग के लिए भी सब ऑनलाइन शॉपिंग हो रही है. फ्रेंड से चैट करना है तो फोन पे चैट हो रहा है. I mean, they are just not away from the phone. पहले तो फिर भी ये था कि थोड़ा सा उठ जाते थे, but now they just don't get up. I mean, they are always either on the phone or in the bed, or they are just watching TV. अब तो TV watch करने की भी जरूरत नहीं, because everything is on the phone. And पहले ये होता था कि we used to go for shopping to the market with mothers, with sisters, with aunties. But now everything is available on the online. So they are just shopping everything online also, and they have the privilege to get, to select
the advice for her problems. So Dr. Sarika Agarwal, the dais is yours now.
Thank you, Rituji. Thank you so much for the kind introduction. And I hope to all.
Yes,
am I audible?
Yes, you are.
So my job has been made very, very easy by Sunita ma'am. Actually, I think PMS and PCOS, all these are sisters, I suppose. In adolescent young females, more or less having the same etiology, what ma'am told, like sedentary lifestyle and the changes what our adolescents are doing and experiencing in this era, the Gen Z generation, these are the lifestyle diseases. So we often see those patients, and it is really pity to see them, because they are so young girls. Actually, now the age of menarche has been shifted to, like, in our scenario, so what was we read about 12 to 13 years. Now I think Dr. Sunita will agree that now the menarche age has shifted to 9 to 10 years or something like that. So these young girls, they are so young, and now they come with all these symptoms of premenstrual, and they don't know what they are going through. And all these are I believe is the only our lifestyle changes which we have. I often say to the parents that these are the diseases which we have themselves brought to our homes. It is not like the child is having or the patient is having anything. So there is a patient X who comes to a gynecologist department, 19 years of age, and she's experiencing the symptoms a week before the start of menstrual cycle, like headache, acne, changes appetite, abdominal bloating and cramping, mood swings, depression, sleep disturbance, muscle and joint pain, breast tenderness. And a very common symptom is breast tenderness, what the child, and not able to concentrate on studies, sleep disturbances. These are very common. And abdominal bloating, which I have seen in my practice, is very common. So these few symptoms are very common, which a mother brings her daughter. Usually a mother brings her daughter to our clinics with all these symptoms which her child is experiencing. So for making a diagnosis of premenstrual syndrome, we should be very cautious, and good history is a must. A typical history is that a week or 2 weeks before the onset of menses, the child will start experiencing these symptoms, one of these symptoms or multiple symptoms, and which will slowly and slowly increase. It will increase to just 2 days before the menses. It will have its peak, and then the child will have his menses, and then these symptoms will wane off. Next cycle, the same thing gets repeated. So it's very essential to ask the mother or the female or the adolescent girl whether she's having all these symptoms like this only. Is this a cyclical thing? Every time before menses she's having, and after menses she is having a relieved. So this goes in the helps us to make a diagnosis of premenstrual syndrome. So now the important thing, what is the causative agent? Amount of diet and a correct amount of exercise. So counseling is the major stay in the treatment of these kind of patients. And all these are a part of counseling only, to ask them to regulate their stress levels. Actually, the stress levels, what I have said is like the patient will have bloating, she'll Google it, ensure they have sufficient sleep. The sleep patterns should be normal, and restrict the consumption of alcohol. Today, the very young girls, very young child, it's cool to be taking alcohol. It's like they get the vibes or whatever this is. So very young patients start having alcohol. They are on drugs, everything. So stop the alcohol, caffeine, nicotine. These are all bad for health. We have to ensure them. It is not a cool thing to take. Get regular exercise, which is very, very, very necessary. It has to be emphasized. The exercise part has to be emphasized. And there was a very hilarious something. A girl came to my OPD. I just asked her, "Do you play games?" She said, "Yes." I said, "What games?" "Video games." They have to understand it is not video games. Games are like something, badminton, lawn tennis. They have forgotten what are games. For them, games are the mobile games, the video games. These are not the games they have to play at their age. They have to go out and play. So this is the kind of the emphasis on regular exercise and the dietary supplements, which are like what ma'am said, vitamin D, and like it's the pathetic situation at the supplement vitamin D to our children, vitamin E, B, and PMS, what studies have told, and we have seen it, calcium, magnesium, and omega-3 fatty acids. All these, the lab test, which I have told you already, it is just to rule out the other scenario. And yes, if it is a severe PMS or premenstrual dysphoric disorder, which is a very severe form of PMS, then endometriosis should be ruled out. As it is, I don't think there is any harm in getting a baseline ultrasound done of these females. It can be said, because sometimes this endometriosis and everything, we just can't, but maybe sometimes there is a possibility we are treating for PMS and we are not ignoring things. So just a baseline ultrasound can be done. But there's always a darker side, because all these sonologists, they'll label it as PCOD. And now again the battery of events will start.
For this pain. And the best part you said is bloating hua for this pain. And the best part you said is bloating hua, and they googled it and they say कि जो सबसे worst उसमें होगा कि हमें तो यही हो रहा है. So actually, somehow or some other, we have to counsel these girls and we have to create this education that premenstrual syndrome or primary dysmenorrhea is very, very common. All ovulatory cycles have some pain. Give them some analgesics and they will be comfortable. You have to counsel the mother that for every cycle, you don't have to ask her to sit at home for 3 to 4 days just because she is having dysmenorrhea. No, she is going to have it for her whole life. That doesn't mean that every month she is going to be absent from her school, college or work just for dysmenorrhea. Second thing, I think about 15 days back, I had a patient She had a very small fibroadenoma. I mean, all of us are seeing fibroadenoma so commonly, and we know what is fibroadenoma and what is breast cancer. This girl was only 14 years, and she came to my chamber. She entered with her parents, mother and father both, and they both were crying. I said, "What happened?" तो उन्होंने बोला हमारी बेटी को ब्रेस्ट कैंसर हो गया है। I said, अच्छा, at 14 years, for last 30 years, I have seen the youngest age of 30 years, maybe one was 28, I think. Otherwise 35 and otherwise 40 plus, 45, 60, that's different scenario. So I said at 14, I have never seen, let me just examine her. And I saw it was a very small fibroadenoma. And I told them that it is just a very small fibroadenoma, which is 100% benign. I'll just remove it and she will be fine. Sometimes even we don't want to remove it also. Then the girl said, I have read it on Google, all breast lumps, what are they? And they said it may be cancer. So I am having cancer. So you very rightly pointed out that they will actually pick up the worst thing, that I am having this and this is because of that. So this is very important. This is actually our job to train them to I mean, I don't know how to go about it, how to give these messages to the school-going girls, college-going girls, to make awareness programs that all PMS doesn't mean that it is something very serious and this is not natural. Second thing, you very rightly said that this condition also needs only and only counseling and maybe some supplementation and some analgesic which can suit her. So that is all. But these both the cases actually I would like to congratulate British Biologicals that they have picked up very, very common cases, day-to-day practice, which we all are seeing in our day-to-day practice, and we want to emphasize not about pharmacological treatment but about lifestyle modification and nutritional supplement. Dr. Ritu.
Thank you, Dr. Sarika, for presenting the holistic view on premenstrual syndrome. It really was a very nice talk. Now we open the house for questions. If the house has any questions, they can put in the chat box. There is one question, I think, Sunita ji, this is for you. What is your opinion about myoinositol supplementation in patients of polycystic ovary syndrome?
So it's a very nice question. Thank you for asking this. Combination of myoinositol, decarinositol. This is all about bringing down the insulin resistance. It doesn't decrease the weight, but it can actually regularize your cycles, especially in lean PCOS, where we cannot, or we are worried, or we are afraid to give metformin. This is a good combination. Second thing, in obese patients also, combination of myoinositol and metformin works better. They work in synergistically, and that is why myoinositol and metformin combination is good. So without even doing blood sugar levels, myoinositol can be given to these young girls, which is harmless. And if you are giving it for minimum 3 to 6 months.
Net connection. I think there is no other question. So you have very well cleared the topic and cleared their doubts. And with this, we come to the end of this session. And thank you for a meaningful and enriching discussion. I am confident that this session has clarified the topic and was worth your time invested. Thank you, Dr. Sarika and Dr. Sunita. And now I hand over the session to Ms. Divya.
Thank you, Ritu, ma'am. Thank you, Dr. Ritu, for such a being a good coordinator.
Thank you, Dr. Sarika. Ms. Divya, please.
Dr. Sunita is waiting in the lobby. I think she wants her entry.
I think I've admitted her. Good evening, everybody.
I'm so sorry. I don't know what went wrong. Achanak se ekdam.
Okay. So, good evening, everybody. Yes. I'm Divya Priscilla, head nutritionist at British Biologicals. I'm very glad here to be part of y'all as well as the other delegates who are here to inaugurate Teens Pro at this webinar. So based upon our discussions that we had, how much of nutrition is important in Teens Pro or for a teenage girl from the age group of 13 to about 19 or 20 years old. Amar sir, do we have a slide over here?
Hope it is visible.
Yeah, it's visible. Thank you so much. So how much nutrition plays an important role in the rising concerns that a teenage girl would face? Especially this is a formulated nutrition supplement for the age group of 13 to 19. And this is a holistic approach that we've looked into addressing the issues like how Dr. Sunita was talking about PCOS, PMS, and any dermatological manifestations that the teenage girl would undergo. So we have come up with this product, Teens Pro, with the nutritional facts, if you look at it. So mainly focusing on the kind of protein that we have given in this product. So there's a blend of 4 proteins. So it is whey protein, concentrate, isolate, soy isolate, and skim milk powder. So if you look at the serving size of this product, which is about 40 grams, in that we have given a good quality protein of about 11 grams protein, which is all from a good source of protein. And also looking into the other aspects in concern to the conditions like PCOS, PMS, we have soya isoflavors, which is about 80 mg per serving. And when we look at the dermatological manifestations, we have vitamin E, collagen, biotin, which all helps in or probably resolves the issues of any issues that the girl would be concerned about, would be hair, skin, nails. These are the nutrients that play a major role. And vitamin D, iron, especially in conditions like anemia, which is one of the concern in young teenage girls. These nutrients in recommended allowance by the ICMR, we have established and given a percentage based on the requirements for per day. And if you look at the ingredients, that is very, very important, is we have a blend of fruits and vegetables, which provides the fiber content of the daily requirement. So if I may say that when we look at the protein content, just one serving of Teens Pro would be giving about 11 grams of protein. But on the contrary, if you look at it, if you have to take about 1/4 cup of a masoor dal, which gives you about the same equivalent grams of protein, or maybe 2 eggs a day would be giving about 11 grams of protein. But this is made such that it is easy, convenient for a young girl, not depending upon anybody, especially her mother, to give her some kind of a food which she could manage to take on a day-to-day basis. So she could just take in 1 scoop, add it into this sleek shaker that is provided with the packaging. If you look at the packaging, it is international grade packaging, a hard monocotton to prevent any such damages. And we have an inner pouch, which is sealed tight. And we have 2 different flavors. When you look at it, are cookies and cream and Dutch chocolate. So these are the 2 flavors. All the ideas and thoughts have been put with discussing and looking into the main age criteria that we have is modern girl, right? So we did not want to come up with anything that is boring or already done previously in the market. So these are the 2 amazing flavors that we have, and she could definitely add a scoop and shake it well with milk or water. If she's concerned about her calories, then she could go with water. If she's not concerned, and if it is just the nutrient requirement for the day that she has to take, then she could probably take it with milk, and maybe 2 servings a day that's about 80 grams, where she would be meeting nearly about 80% of her requirements in protein through the nutritional supplement. So this is the combined, a gist of the Teens Pro. And more so in detail, we have these nutrients which could tell us about how the product is done. So I'm very happy to share these information. If you have any doubts or any clarifications, you could definitely reach out to us. Thank you so much.
So dear delegates, thank you very much for your valuable attention and valuable time you have contributed to this session. And we greatly appreciate your participation and look forward for your valuable association with us in future and further sessions under GynTutor platforms. So with this, I would request you and to help us in your prescription support for our products like B protein, D protein, and Napropium. So, and also, Doctor, for the first time in India, what we have came up with the brand called Teens Pro. So I declare this session concluded successfully and would request all to log out. Thank you very much. Thank you very much.
Thank you.
Thank you. Thank you, everyone.
For the call policy.